Yes, actually, I was really struck by the conversation about values. And obviously, values within the healthcare economy is really important. Coming from the UK, I'm quite skeptical about private healthcare in terms of the way that private healthcare can deliver impact. However, we do know that where the public are paying directly for their care, they have the reason to vote with their feet. If you're not providing the care and the value that they expect, if you're not delivering it in a way with integrity, then your patients are going to vote. They're going to vote and walk away and go to another provider. And that's a really, really big impact in terms of the value of the care that you provide. We actually believe that decreasing variation in practice can increase the value that you receive in healthcare overall. And you'll probably recognize this equation in terms of value-based care, where value is recognized as quality over cost. And in fact, when you look at this in more detail, the outcomes are actually with patient experience are absolutely key in that piece when you look over the top of direct and indirect costs. If the patient is not experiencing the value that they expect, then they won't have necessarily the right outcomes as well. If you look at healthcare in the same instance, actually healthcare is about as safe as bungee jumping. It is actually significantly more risky to go to hospital and have an operation and not come out with a hospital-borne infection, not receive an injury associated with the wrong drug being given, and far more risky being in hospital. And variation is an interesting area because a lot of doctors would say, actually, we're the experts. We're the ones with the experience and knowledge. And it's often been seen as an art rather than a science in terms of medicine. And there's a challenge to that in as much as if you give the latest drug, is that drug being validated against a trial? Has it been demonstrated to have the impact, the efficacy that you expect to have on the patient or not? What is the toxic effect of that drug? Do we understand what the impact will be in long term? When doctors make their own decisions, not based on evidence, not based on the latest research, that's when you get variation in practice. But it's not just variation in terms of the drugs that are given, it's also that the experience and knowledge of people as well. And we're seeing a transformation in terms of knowledge growth. It's estimated by 2020, not very far away now, that healthcare knowledge is going to be doubling every 73 days. That is a huge amount of information. And if you think about the exabytes of data that have been generated through wearable technology, through the IoT in terms of the information that we're gathering around patients and what's going on, managing that information and understanding that as a doctor is becoming more complex. You don't have the time necessarily to understand what the latest information is, and sourcing that is really important.